Early this year, my wife and I signed up for a new health insurance plan, and I wondered, how do they determine my premium on a monthly basis? What individual factors do they account for? And the reason why is because I knew that they had data that they were pulling from, but I wasn't quite sure how they were making those calculations on a broad basis. So, a couple weeks ago, I found some data from healthcare.gov that is qualified health plan insurance data. And if you have any questions about the data source, you can always find it at arcosanalytics.com. So, let's get into this. As you can see, we're talking about qualified health plan insurance data for a variety of states. The data only provided specific counties, but this can at least give us some insights into how they determine premiums. And a few things I will tell you as far as our findings so far is that it's determined by the competition in the area as well as your age. Those are the first two things that came to my mind. So, for example, in Montana is generally cheaper for healthcare insurance than Wyoming for some reason. But in some places, it's more expensive. And so there is a variety of different fields that you can choose from in order to understand which healthcare insurance is better for you. And where you live matters a lot, but also your age and other conditions matter as well. And taking a step back, if you've ever signed up for insurance, you usually go into a portal or you usually answer a series of questions on a form to determine how much you're going to pay as far as health insurance. But I wondered, are these all calculations or is this based on historical data? And based on this information here, a lot of it is based on historical data and then modified based on the data as far as population is concerned. So if we look at the fields here, you can determine that there are different issuers that provide insurance based on this data. There is Anthem Blue Cross Blue Shield, Health Care First, Kaiser, Mountain Health, Pacific Source, etc. But most healthcare insurance providers have different metals that they organize their plans. And so there's a specific marketing name where it's marketed specifically, and you'll see that as, hey, do you want the Anthem Bronze, et cetera, plan? Or do you want this plan? And the names are actually really confusing, but the metal level is really helpful because, for example, if we choose a bronze metal level, we can see that the bronze metal level is the cheapest, most bare bones level you can have, but it's only available in certain counties. And so that bronze low tier level is not really available across the board. It's available in specific counties and specifically in Wisconsin here. And as you can see, there are only counties where you're paying $200 on average in Virginia. And then in Wisconsin, it varies by county. But age matters a lot as well. So if you're an individual who's age 21, then you're going to be paying for this bare bones minimum level $230, but it goes up by age. But if you choose a more whole plan or a more extensive plan like a gold or platinum level, you'll see that it's generally widely available across the different data sets that we have available. But one of the things that I found interesting that this map really helped me understand is if I go and I go up to this area up here where it's these specific counties in Maine and not West Virginia, Vermont, and New Hampshire. I'm sorry, my Northeast is a little bit fuzzy, but in New Hampshire, you can tell that they're generally less expensive. But up here in Maine, in the middle of nowhere, in the boondocks, why is it more expensive up here? And I can tell you exactly why. The reason why is because there aren't as many providers up there in the middle of nowhere. And so because there aren't as many providers, then the cost is more expensive. And so the plan type counts as well as everything else, but you can also tell that, for example, if you look at something like Blue Cross Blue Shield, they're only available, for example, here in New Hampshire. But there are other providers that provide data across different counties. And so you can select different ones to understand where you are and what county you're located in. And so if we move on from this and we want to compare them by state, this is a way that you can compare and understand on a state-by-state basis based on your situation, which state is less expensive. So for example, Virginia has a really low premium on average, but it doesn't necessarily or may not necessarily apply to your specific situation. So for example, in my situation, I am an average premium for a couple that is in their 30s. And so in my 30s, what does it look like? And so for example, Alabama has the lowest premium level for every metro level. So I'm going to pay for both of us an average of $646 per month for a qualified health plan. But as you can see, if you live in Ohio, like Cincinnati or another city like that, you're going to be paying the most depending on the metro level you want. So if you want a gold or platinum, then you can select gold or platinum and you're going to be paying $1,200. And in Atlanta, the lowest, you're going to be paying $700. Virginia's not bad. It's a little bit more expensive than Atlanta, but where you live matters a lot. And what I'm going to show you next is where you live if you're retiring matters a lot more. And your health care plan may matter more than taxes, depending on your situation. And it's quite interesting. But that's one of the conclusions I had is if you're retiring, a lot of people look at what they're paying for state income tax. And I sure understand that for sure. But another thing you have to take into account is how much of a premium are you paying? Because if you're paying a difference between $646 and $1,400, then that makes a big difference. What I'm going to show you by age is that for every single county, there is a huge step up by age. And it's quite interesting to see because if we look at something like Alabama or Georgia, for example, if we can compare them, you can see that there's a huge step up. And you can compare the step up. So for example, if you're an adult who is 21, then you're going to be paying $284. But by the time you're 60 years old, you're going to be paying $700, which is more than twice the amount. But here, if you live in either Alabama or Georgia and you pay for Kaiser Permanente, then you're going to be paying almost 3 times as much by the time between being 21 and being 60 years old. Now, if we want to just look at Alabama, for example, then we can see, okay, we're just paying this. But in Georgia, for all issuers, Blue Cross Blue Shield and Kaiser Permanente, then you can notice that step up. And it's a huge step up, let's say even between 50 or 60. And so I hear on the internet or in different places, why has my healthcare premium gone up? And the most likely reason why is because you're getting older. I mean, that's the same case for me you don't see much of a difference in step up between age 21 or 27 or 27 to 30. But when you get between 50 and 60 plus, that's where it matters a lot. And so one of the findings that we have here at Arcos Analytics that I've been able to ascertain is that based on your age, your premiums are determined most likely based on your age. And then other factors, if you're a smoker, if you're more healthy, your county, all of those specific factors play into it after the demographic data based on age. So age is the huge factor to take into account. But as you can see, there are some bigger step ups. So for example, in this case, for adult care insurance, you're stepping up to $1,200 all the way from $264. So you're going from $264 when you're age 0 to 14, or you're going from $472 all the way up. So it can triple in your lifetime. And so if you go, so let's say you go from a place like, let's say Wyoming or Montana, and you move to Alabama, you could take something like a step up that is $1,200 and go down to $800. So that's a difference of $600. 12 minus 8 is 6. So you can go down and you can save $600 per month if you move to a different county or different state. And most likely for many individuals, that's not as much as they're saving. Like that's more than they're saving in their tax as far as their income bracket for the majority of people. And so I wanted to just look at some data to understand what are my average premiums per state for different individuals. And so I was able to build this table in Tableau that helped me understand in a tabular form what's going on. And you can see, for example, in Alabama, if you're somebody who's 21, then you're paying this much. And you can compare them, and you can compare your situation by state. And so if you're 60 years old, in Alabama, you'll be paying an average of $1,500, but there are some states for a couple where you're going to be paying a lot more. You're going to be paying $2,000. In Virginia, you'll be paying $600, etc. And so one of the interesting things that I found is that, those snowbirds are actually kind of smart, because you can live in a state that's more northern for a few months of the year, and then you can go south to like Alabama. They don't have data for Florida, but I would say it's probably pretty close to like in Alabama or Georgia as far as insurance premiums are concerned, to do all that they need to do. And you can be saving $600 to $800 a month. And for a lot of people who live up in the north, that could make the difference as far as quality of life, etc. I also wanted to compare them by plan. So they have different marketing names by plan that you can look at to understand. And so if you're looking online for a plan, then you can put in like Anthem, and you can look at the specific plan you want and look at all the plans for Anthem and decide on what you want to see. And so let's say I want to just see all the Anthem plans in my county or state. And because we're working with like 50,000 rows of data, it takes a while for Tableau online to assess this data, but it does it pretty well. There's probably a better way to do this, but I'm just going to, we're just going to compare these plans right here. And suppose we look at a specific state. Sometimes Anthem doesn't provide data for different states. But if we look across the board, then we can see by specific counties what it is. And then also the measure name, we can choose what our situation is. So for example, if you're a couple that is in age 30 with one child, then you can see where you are across different marketing names for your specific situation. So you can look and you can make better decisions that way. And so the reason why I put this together is because ultimately dashboards and data is used in order to improve your decision-making process. If it doesn't do that, then it's quite worthless. And so I just wanted to understand for myself what's going on, but I also wanted to help you understand as well why insurance varies across the board. And this is another table that I put together that just compares platinum, gold, silver, and bronze for specific issuers, so that you can understand by specific situations what your situation should be. So if you are, for example, somebody who is, let's say, in this specific situation here, to where you're an average couple who is in their 40s, 40s, etc., 40s, 50s, and 60s, what's your step up going to be? Because that's most likely your greatest step up is between your 40 and 60. And so in some cases, man, it could double. And so, for example, for Anthem Blue Cross Blue Shield, for like a gold plan, for example, you could go from $1,200 for a couple to $2,500. And man, that's actually a lot when you talk about 12 months, because that's a step up of over $1,000 per month. So that's over $12,000 per year that you're paying more than you would have otherwise paid. And you can look at your specific county to understand where you are, or your specific state. So if you want to look at, for example, Georgia, Maine, Montana, Alabama, etc., and it will tell you what issuers or providers are in that area. So I thought that was pretty cool, because sometimes you can drill down and you can say, hey, I want a gold plan. And then you can say, okay, based on this, what are all the gold plans available to me in my specific situation? At the very last, I wanted to create what I'm calling an insurance search. So if you go to any portal online, there will be a series of questions that they ask you. And after you answer these series of questions, then they will essentially spit out a number and say, hey, this is your insurance premium based on everything that you selected. And so when you sign up for healthcare insurance or car insurance or home insurance or whatever, a lot of times you will sign into a portal, and that portal will ask you a series of questions that will help you determine what your premium is. And a lot of times it's essentially based on the data that they have. And so they have a big database that they have all of their information in, and then you can select different things. So for example, if you wanted 40% co-insurance, or if you had an average, if you had specific situations, then you can look and you can see based on your specific situation where you landed. And so in this, you can specify a specific metal level, your specific county, your situation, and select out what you want as far as your primary care, as far as you want a $25 copay, the percentage that they will cover in emergency situations, how much does it cost for a copay, how much is co-insurance after a deductible, etc. And so these are the things you want to know when you're looking for insurance that isn't necessarily explicitly explained when you insert into a portal. Because a portal is quite simply, you put in everything you want and then you generally choose the situation that's best for you. But you can't quite select out a percentage, a coverage percentage between 99.14 and 99.37, where there's $20, it's a $300 copay, a 20% co-insurance, etc. And so these specific things you may not be able to differentiate in a portal, but you can when you look at the data in this way. So as I conclude, I would like to explain a few different findings that I have gathered in this analysis. The first is where you live matters a lot. If you live in a place in the middle of nowhere, like Maine, for example, there isn't a lot of competition, so your premiums are going to be more expensive. Where there's more competition, like in Atlanta or in Alabama, where people tend to go to get surgery and get their health care, then there's more competition and your premiums are most likely to be lower. The second thing is that your step up matters. So between 40 and 60, there's a huge step up in cost. And so where you live in combination of your age matters a lot. The third is that the way that they market them may not be as accurate as being able to look at the data as a whole. Because when you look at the data, and if you want to analyze the data, then you can understand what plans provide what specific things and how they differentiate as far as cost, what they provide, etc. And so I hope that helped you understand a little bit more about healthcare insurance and helped you understand how you can get a better health plan for you. Thanks, and we will talk to you next time.